I had hallucinations, I was hearing things, and it was very, very scary.
Samantha Mercanti knows firsthand the effects schizophrenia can have. The Hamilton native was in her first year of university writing final exams when she had her first episode.
They actually told my parents to warn me, and I know you look at me now and I look just like a regular person, but for the doctors to say that, it was really bad.
Mercanti received help at an outpatient hospital program and was diagnosed 3 years later. Now at age 44, Mercanti graduated McMaster University with an MBA, has run 3 marathons, and wrote a book on her story, hoping to inspire others.
We are going to have really hard times in our lives, and all you have to do is just keep moving forward, because as an example, I did that and I ended up now I live a very, very well and beautiful life.
A new study published in the Canadian Medical Association Journal found rates of psychotic disorders are rising among those in their late teens and early 20s. Researchers looked at 30 years of health data from more than 12 million people in the province born between 1960 and 2009. The biggest increase was seen in people aged 14 to 20, with diagnosis rates rising by 60%.
The typical age of onset for these illnesses is anywhere from, say, 16 to 35 or so. More recently, the study showed that the average age looked like it was creeping down a little bit.
Psychiatrist Paul Kurdiak, who was one of the researchers on the study, says the rise may be linked to a mix of factors, including better awareness and diagnosis, more people seeking care, increased stress among young people, and substance use.
Any speculation around that is just based on the fact that some of the findings of the rise happening more recently also happen at the same time as things like the legalization of cannabis and more psychedelic use in general.
Psychosis can affect how someone thinks, feels, and understands reality. Social worker and University of Toronto assistant professor Amar Galani says there are several early signs families can look out for.
Disengaging from friends, disengaging from family, noticing someone talking to themselves, noticing kind of irrational fears that are blowing out of proportion. I think if someone is experiencing like a full-blown psychotic episode, going to a hospital is probably a good first step to get help.
Experts say reducing stigma can help people get the support they need sooner, and that continued research and better access to care will be key as more families are affected. In Toronto, Catalina Gillies, City News.